My name is Ducel Jean Belouche. I'm a postdoctoral research fellow in the Department of Psychiatry and Behavioral Sciences, as well as affiliated with the Be Well Institute for Substance Use and Related Disorder. So this is the ReflexXR. I do come with a background of a lived experience. I'm battling with PTSD personally. And during my journey with PTSD, I've managed to be able to move forward in a positive way through creative expression. I'm actually a self-taught musician, so that's actually what kind of helped me to gear towards a holistic approach towards trying to find ways to help support individuals with trauma. In terms of becoming a trauma researcher, it actually started during my graduate program. In my graduate program, I came across the term post-traumatic growth, which is the first time I ever heard about it. And I've always, heard about negativity associated with PTSD. And for the first time, I heard of something positive that can come out of adversity and trauma. And I just fell in love with that term and decided to spend, the rest of my educational journey to better understand this phenomena and to pretty much now having a career of wanting to be able to help to design and promote post-traumatic growth in individuals that's recovering from trauma. So this is a ReflexXR. It's a virtual reality art making platform. There's 5 different experiences, immersive experiences you'll be able to engage into evidence-based art making activities. So right here are the 5 different experiences. The containment, self-compassion, personal strengths, appreciation of life, and new pathways. Dr. Potter and Dr. Okafor, their mentorship has been really helpful, being seasoned scientists. And as this particular project, or this mechanism is a early career funding project, they've helped me to be able to be mindful of certain aspects of a study that's really important, such as managing personnel's financial budgeting, IRB submissions. So their help has been really helpful for real critical aspects that's needed to facilitate a study. It's actually engaging into a flow state, which is kind of like a meditative state, which is actually helpful for targeting emotional regulation. This is actually helpful for interrupting, rumination, intrusive thoughts that individuals with PTSD frequently go through. 50% of individuals with PTSD have a trait called alexithymia. Alexithymia can also be referred to as emotional blindness, where individuals have challenges of being able to understand, describe, or verbally process their emotions. With this particular tool, this allows them to be able to process and get a little bit of a self-awareness in a nonverbal approach. Traditional talk therapy is not as effective because these individuals can't verbally process their emotions and what's going on. So during the study, they will have opportunity to complete each visit once a week. It usually takes between 20 to 30 minutes. One of the external barriers that's associated with PTSD treatment is the wait list. Just here in San Antonio, for PTSD treatment, individuals could be waiting up to 1 to 3 months. By having a tool like this, it'll allow them to be able to, receive help during that wait list, at the comfort of their home. There's also stigma that's in play, that some individuals just don't feel comfortable being in a clinical setting. There's also a workforce shortage where there's not enough PTSD providers. So ReflexXR is a great adjunctive tool that can be used to help support individuals recovering from trauma. Eventually, it'll be open to the public for them to be able to download. You can be at the comfort of your home, your rural area, as long as you have Wi-Fi. That's the only thing that you need is just Wi-Fi. Individuals with PTSD, there's a high portion that experience a substance use disorder. There's a suicide risk and severe emotional distress. And by targeting these mechanisms of post-traumatic growth, we're able to help reduce the cost that taxpayers are having to pay to have to treat these individuals. The ReflexXR is not necessarily a treatment, I would say. It's not to treat PTSD, but more as an adjunctive tool to help support individuals recovering. Research has shown that post-traumatic growth is associated with improved mental well-being, reduced substance use, and could be a protective factor towards suicide risk. The value of it is it definitely can help support the wellness and growth of individuals recovering from PTSD. It doesn't require any clinicians, it's scalable, and it's affordable. With the barriers that's shown with current PTSD treatment, we need innovation to help address these barriers. And with this particular project, we have combined technology, art, and science with ReflexXR to help address this.